Hi, I'm Ted Kruse. I'm a physical therapist with Physical Therapy Solution, and today I'm going to talk to you about stress fractures. Stress fractures are not a common injury, but we do come across them in the clinic, and they occur because of overuse or stress to a certain body part or bone. It's not consistent with a typical fracture that can be more violent, but like I said, an overuse injury will typically cause these. And for that reason, they tend to be in the legs, in the bones of our lower legs and into our feet. So the most common stress fracture areas are typically in the tibia and then also throughout the bones of your feet. Activities that have a lot of impact or forces on your body, such as basketball, tennis, track and field, and gymnastics are very common to cause a stress fracture. We've also seen patients that can get them from new activities, such as if walking is new to them or a new type of exercise that their body typically isn't used to. They occur because the overuse on the bone over time wears on the bone, starting to cause a weakened area and can result in this fracture. The most common symptom people will have is pain, and typically we wait for that to go away, and when that pain doesn't go away, we'll look into it further, either seeing a physician or people coming to physical therapy. If they're not responding as we'd expect them to, then oftentimes we'll send them back to their doctor to get it looked at. The challenge with a stress fracture is sometimes an x-ray doesn't pick up on it right away because the fracture is so small. So sometimes it can be 2-3 weeks, even a month before an x-ray will actually pick up a stress fracture and will actually show the healing process instead of the fracture itself. To treat a stress fracture, the primary objective is to remove the stress from the body. So if it's a sport or an activity, we have to take a break from that. We'll also protect the area, so if it is in the lower leg, a walking boot can be used, and we typically follow normal healing time, such as 4 to 6 weeks. Then a follow-up with a doctor can determine if this fracture is healing and if somebody can return back to their normal activity. In physical therapy, we can help that along by making sure other muscle groups stay strong, making sure range of motion is maintained, and also following up to making sure that the patient is not doing something that will hinder their healing. I hope you learned a little bit more about stress fractures. If you have any questions, please give us a call at our Manchester or Dyersville location. We'll look forward to watching our video next week on our Facebook page. Thank you very much.